So hello everyone. Today in this video we are going to talk about alopecia. Alopecia means hair loss. Loss of hairs in any region of the body is called as alopecia. So hairs present in our body are of two types. The first type is vellus hair while second one is a terminal hair. Vellus hairs are fine, light colored and straight, while these terminal hairs are exactly opposite to that of vellus hair, means they are thicker, dark and they may be curly. Talking about these terminal hairs, in neonates these terminal hairs are present in the scalp region and region of eyelashes and eyebrows. These hairs are non-sexual, means they are not depend upon the androgen, or we can say that they are androgen independent hairs. At the age of 8 to 10 years, there is slight increase in the plasma testosterone level because of weak adrenal androgens, and these terminal hairs are appear on the forearms and the legs in both boys and girls. At the age of puberty, there is further increase in the plasma testosterone level, and in case of females, these terminal hairs are appear in the pubic and axillary region, while in the boys and further advanced puberty with the adult males, they develop these hairs in the regions such as face and trunk. Testosterone is the main hormone responsible for all these things, and this circulating testosterone is converted into dihydrotestosterone inside the skin, which acts on these hair follicles and which is responsible for growth of ambisexual and sexual hairs. So ambisexual hair means those hairs which are common in both sexes, that is boys and girls. It is also responsible for normal temporal recession in normal adult males and abnormal temporal recession in adult females, abnormal growth of sexual hairs in women and children of the both sexes. Hair growth cycle. So this hair growth cycle is divided into three different parts: anagen, catagen and telogen. Anagen lasts for 3 years, catagen lasts for 3 weeks, while telogen lasts for 3 months. Anagen is also known as a phase of growth, catagen also known as a involution, while telogen is the resting phase for the hairs. There is a balance in between these phases. Sometimes there is a disruption of the balance, and this disruption causes telogen effluvium. So what will occur in this telogen effluvium? So there is a disruption of balance among these phases, and many hairs enter in the telogen phase, which is abnormal. And this telogen phase lasts about 3 months. Later these hairs are shed in the bulk, causing the alopecia, and this phenomena is known as a telogen effluvium. I quickly revise all these points. So alopecia means loss of hairs in any region of the body. Okay, so hairs present in our body are of two types: vellus hair and terminal hair. Vellus hairs are light, fine and straight in nature, while terminal hairs are thicker, dark and they may be curly. Talking about terminal hairs, there are three different groups. One is neonates, then at the age of 8 to 10 years and at the puberty level. So in the neonates, these hairs are androgen independent, or they are also called as non-sexual hairs. At the age of 8 to 10 years, where there is a slight increase in the testosterone, these hairs are appears on the forearms and the legs in both boys and girls. At the age of puberty, there is slight increase in the plasma concentration of testosterone. So in case of females, these hairs are appears in pubic and axillary region, while in the males, it present in the face and the trunk. For all this process, circulating testosterone, which is converted in the skin into dihydrotestosterone, is responsible. Hair growth cycle is divided into three different parts: anagen, catagen and telogen. Anagen for 3 years, catagen for 3 weeks and telogen for 3 months. There is a balance in between these three phases. When it becomes imbalance, many hairs enters in the telogen phase, and it resulted in the alopecia. This type of alopecia is called as a telogen effluvium. Talking about alopecia, the alopecia in the scalp, it can be scarring alopecia or non-scarring alopecia. Scarring alopecia is associated with inflammation, fibrosis, destruction of the hair follicles due to primary skin disorders like lichen planus or systemic diseases like lupus erythematosus. While this non-scarring alopecia is temporary and it is reversible in nature. Causes of this non-scarring alopecia is dandruff, diet, physical trauma, chronic illness, and androgen axis. Forms of alopecia. There are three different forms of alopecia: androgenic alopecia, alopecia areata, and androgenetic alopecia. Androgenic alopecia is occur in women and due to elevated levels of plasma androgens. Androgenetic alopecia, it is a hereditary disorder due to excessive conversion of testosterone into dihydrotestosterone in genetically susceptible men and women. Means it occurs in both sexes. In males, it ranges from bitemporal recession to thinning of hair in frontal and vertex region to complete baldness except occipital and temporal region. While in women, thinning is less severe than the men but maximum in a frontal and parietal region. Treatment comprises minoxidil in both sexes. Alopecia areata, it is a non-scarring alopecia. It consists patches to complete baldness. Hair tend to regrow on the bald patches, but the reoccurrence is common. Treatment comprises topical minoxidil and topically injected glucocorticosteroid. Talking about this minoxidil, it is an antihypertensive agent. When applied locally as 2 to 5% solution for prolonged period twice a day, it may produce some hair growth in few patients. The results are best in mild cases and good to excellent results are seldom seen in more than 30% of the patients even after prolonged use. Minoxidil increases the dermal blood flow. Further, it causes elongation and normalization of the hair follicles.